Better for tomorrow. National Rehabilitation Center for Persons with Disabilities. The National Rehabilitation Center for Persons with Disabilities, under the Ministry of Health, Labor, and Welfare, is a core institution of rehabilitation for persons with disabilities. It plays a leading role in providing a variety of services, from healthcare to vocational training, in a consistent and systematic manner to support independence and social participation of persons with disabilities. Dividing the persons with disabilities in Japan into 3 groups, with physical disability, intellectual disability, and mental disability, the estimated numbers of them are 3,982,000, 741,000, and 3,924,000 respectively. The numbers of them per 1,000 people are 31, 6, and 31 respectively. Although they cannot be simply summated because there are persons with multiple disabilities, this means 6.7% of Japanese have some type of disability. The center provides a variety of services, including medical rehabilitation, welfare for persons with disabilities, research and development, cultivation of rehabilitation professionals, health promotion, and support for medical science for persons with disabilities, and international cooperation. As a national institution, the center also plays a role in providing the services that are difficult to receive from private facilities, as well as introducing the measures and policies promoted by the government and spreading them across the country. The center has kept enhancing its organization every year since it was established in July 1979. Today, the 6 departments, which are Department of Administration, Department of Planning and Information, Hospital, Rehabilitation Services Bureau, Research Institute, and College, work together to provide comprehensive rehabilitation services for persons with disabilities nationwide. To start with, let us introduce the hospital. Under the principle of trusted, good quality medical rehabilitation, the hospital provides safe and high-quality healthcare services best suited for each individual patient and makes efforts in developing rehabilitation medicine and healthcare for persons with disabilities, as well as cultivation of rehabilitation professionals. The hospital respects the rights of patients and provides patient-centered, safe, and compassionate services, while it makes effort in developing new rehabilitation technologies. To provide high-quality rehabilitation services, rehabilitation professionals from various fields, such as physical therapy, occupational therapy, speech-language-hearing therapy, and clinical psychology, work in a team and provide assessment, training, and support to social participation for persons with disability of movement function from spinal cord injury or amputation, persons with paralysis or higher brain dysfunctions from cerebrovascular disorders or traumatic brain injury, persons with hearing or speech disability, persons with visual disturbance, persons with developmental disorders, and persons with other disorders or disabilities. The hospital also provides health screening and highly specialized outpatient services for persons with disabilities, such as higher brain dysfunctions and hearing loss. Unlike ordinary rehabilitation hospitals, the hospital provides remedial gymnastics, prosthetics and orthotics, and low vision training to satisfy a variety of needs to support independent living and employment of persons with disabilities. The remedial gymnastics is useful to maintain and enhance basic physical fitness, to improve daily activities, and to improve mental and physical activities through sports, recreation, exercise, and so forth. Prosthetics orthotic therapy is to manufacture and repair prostheses and orthoses, including prosthetic limbs, and it can treat difficult cases for private facilities. The low vision training provides assessment of visual performance in tandem with the Department of Ophthalmology and provides assistance in choosing optical aids, ambulation training, and welfare consultation as needed. Furthermore, the hospital is characteristically prepared for patients in early stages of disabilities, regardless of disability certificate. Life in the ward is a time to learn the basics for daily living activities and to be trained for social participation. The hospital has a well-equipped environment suitable for various disabilities. Ward staff, including nurses, provide mentally and physically friendly rehabilitation nursing so that patients can fully demonstrate their potential to achieve their goals. In the year 2010, the hospital opened the Center for Sports Science and Health Promotion. Through medical research and specialized support to assist and popularize health promotion and sports for persons with disabilities, the hospital backs up those who have just taken up sports and top athletes alike. Secondly, let us introduce the Rehabilitation Services Bureau. As a designated support facility for persons with disabilities under the Act on Comprehensive Support for Persons with Disabilities, the Rehabilitation Services Bureau supports persons with disabilities to adapt individual aptitude to suitable employment and to have stable life in a community. As well as this center, the Bureau has Hakodate Vision Rehabilitation Center, Kobe Vision Rehabilitation Center, Fukuoka Vision Rehabilitation Center, and Beppu Rehabilitation Center for Physical Disabilities. It also has Chichibu Gakuen Institution for Children with Intellectual Disabilities as a designated welfare-type residential care facility for children with disabilities under the Child Welfare Act. The trainings provided by the Rehabilitation Services Bureau are broadly divided into rehabilitation services and transition support for employment. The Bureau provides suitable rehabilitation services in accordance with users' preferences and requirements. Rehabilitation services provide training for independent living and living skills training. The training for independent living is targeted to persons with visual disabilities and persons with quadriplegia, mainly caused by cervical cord injury, and the living skills training is mainly targeted to persons with higher brain dysfunctions. The trainings are to maintain and improve living skills and to support smooth transition to community life. Basic training necessary for employment is also provided. After completing these rehabilitation services, not a small number of users proceed to transition support for employment. Transition support for employment is targeted mainly to persons with physical disabilities and persons with developmental disorders to provide services including occupational training. The support provides practical training designed for persons seeking employment to learn necessary manners and occupational resistance as a professional through skill trainings, workplace experience, and various on-the-job training. Driving assessment is also provided, and driving lessons for ordinary vehicles are available to those who have driving aptitude. Another type of transition support for employment provides training courses for manipulative therapist, acupuncture therapist, and moxibustion therapist for persons with visual disabilities. To support an acquisition of the national qualification, the training includes specialized courses such as anatomy, Oriental medicine, and on-the-job practice, and humanity and natural science to acquire knowledge required for the national examinations and clinical practice. Health and physical education is also provided to help maintaining healthy living. Voice-assisted PC and Digital Accessible Information System, DAISY, as well as Braille, are used for daily lessons to help learning how to use them. Furthermore, Division of Medical Affairs supports training and residential life from the aspect of healthcare. Regular support meetings are attended by the specialists involved, and enthusiastic opinions are exchanged to provide appropriate services for the users and support plans for each individual user. Various events, like a sports festival, are held to present the user's achievements and to promote health and friendship. Our relationship with the community is especially strengthened through the cultural festival. Support for residential care is available for those who have difficulty attending daytime training while living in a residential facility. Users from all over Japan are taking part in training every day to rehabilitate into society. The Research Institute takes advantage of close location to clinical environment, such as the hospital and the Rehabilitation Services Bureau, and promotes research and development of assistive technology, assistive products and systems for independence of persons with disabilities, and improvement in their QOL. The Institute also researches the government's policy-making belongings concerning persons with disabilities. The Department of Rehabilitation for Brain Functions researches, among other subjects, brain-machine interface, BMI, so that persons with severe disabilities can communicate or operate devices. It enables, for instance, them to express their feelings or operate electronic devices like the television and radio without physical movements, using their remaining functions with lines of sight and brainwaves. The Department of Rehabilitation for Movement Functions researches rehabilitation technologies and rehabilitation therapies for persons with disability of movement function. The researches of ambulatory rehabilitation for persons with spinal cord injury include basic study on spinal regeneration by suspended gait training. Furthermore, the department also aims at development of novel therapy for health promotion of persons with disabilities of motor function. Other activities include Sheeting Clinic, based on the study on treatment and prevention of bed sores for active patients with spinal cord injury. The Department of Rehabilitation for Sensory Functions conducts research to find mechanisms of disorders of sensory functions, such as visual and acoustic senses, and to develop new methods of diagnosis and therapy. In the field of visual disabilities, the department researches specially retinal pigmentary degeneration with applying regeneration technology. In the field of hearing disorders, it researches synaptic abnormalities of inner ear and so forth that causes difficulty in hearing. Furthermore, it researches and develops, such as dysfluency and deafblindness, to solve problems of communication disorders. The Department of Assistive Technology conducts research about assistive products that play an important role in supporting daily life of persons with disabilities. We have three keywords: people, life, and products, aiming to develop cutting-edge technologies for users' wishes coming true and to evaluate commercialized assistive products. Assistive products include prosthetics and orthotics, mobility support devices, information and communication support devices, and cognitive support devices, and so on. To support cognitive function schizophrenia, medication self-monitoring system for persons with schizophrenia, and information support robot system to remind schedules for persons with dementia are being developed. The Department of Rehabilitation Engineering aims at improving QOL of persons with disabilities by developing technologies to assess disabled functions and substitute impaired functions. The department has developed software to assist schedule management and work sequence management for persons with higher brain dysfunctions with memory disorder. The software is provided for free. Furthermore, it develops special electrodes and sensors to detect physical status of persons with disabilities. The Department of Social Rehabilitation researches promoting independence and social participation and securing the safety of persons with disabilities. The department has published educational materials on the website such that persons with developmental disorders can learn their preparation for disasters for themselves. The Department of Prosthetics and Orthotics manufactures prosthetic limbs to supplement the appearance of lost limbs and their functions, and orthoses to reduce functional disabilities, researches and evaluates their repairs, and moreover, primarily reviews on safety and functionality of the parts to complete the prostheses. Furthermore, the department develops sporting equipment with considerations with improved safety and competition ability in a proactive approach. Thirdly, let us talk about the cultivation of rehabilitation professionals. The college is a department of education and training that provides education for specialists who provide rehabilitation for persons with disabilities and support for children with disabilities, as well as on-the-job training for professionals working at local governments and medical and welfare facilities. Aiming at cultivating professionals who can play leading roles in the field of rehabilitation for persons with disabilities and intellectual and developmental disorders, the college's pioneering education courses in Japan include the course of Speech-Language-Hearing Therapy, the course of Prosthetics and Orthotics, the course of Rehabilitation Worker for persons with visual disabilities, the course of Sign Language Interpretation, the course of Inclusive Physical Education, and the course of Support Worker for children with developmental disorders. Lessons are mainly joined by professionals from different fields, as well as their supervisors, to provide an education taking full advantage of knowledge and skills accumulated by the center. The training courses are to cultivate human resources meeting the needs of society by providing various training for professionals working in the fields of rehabilitation and intellectual and development disorders all over Japan. Furthermore, the course of Certified Nurse in Stroke Rehabilitation Nursing provides high-standard education for certified nurses with proficient nursing skills and specialized knowledge. The center plays a role as a core facility of Japan for developmental disorders and higher brain dysfunctions on which legislations have recently improved. As the core center of each facility to support persons with developmental disorders and higher brain dysfunctions in Japan, Information and Support Center for Persons with Developmental Disorders and Information and Support Center for Persons with Higher Brain Dysfunctions are established and provide human resource development by collecting, analyzing, and publishing the latest and reliable information using the website, and by seminars and workshops on research and studies. These centers aim at an improvement in comprehensive service by increasing public awareness of each disability, by strengthening the support systems in the fields of healthcare and welfare, as well as by promoting transition to community with possible employment. Finally, let us introduce our international cooperation activities, including collaborations and exchanges with international organizations and related foreign institutions. As a WHO collaborating center for disability prevention and rehabilitation, the center promotes the activities of WHO, while it disperses the guidelines and documents published by WHO and holds international seminars. The center also participates in the Technical Cooperation Project, including Japan International Cooperation Agency, and provides technical assistance through training for foreign rehabilitation professionals. In the year 2011, the center signed an operation agreement with 3 centers to exchange technology and information among rehabilitation professionals with China Rehabilitation Research Center and Korea National Rehabilitation Center. The center has received roughly 10,000 foreign visitors from approximately 160 countries and regions in the world since its establishment, and introduced its healthcare and welfare services and research. Today, the welfare in Japan is aiming to establish communities where persons with disability may live independently. To comprehensively support daily living and social participation of persons with disabilities, the National Rehabilitation Center for Persons with Disabilities continues its support from the viewpoint of persons with disabilities as a core institution of rehabilitation for them, from now and in the future.